Welcome. Let's look at the sternum. The sternum is also referred to as the breastbone. It is an elongated flat bone that is seen in the anterior part of the thoracic cage. This is the thoracic cage that is highlighted in white. And in the anterior region of the thoracic cage is where we have the sternum as an elongated bone that extends from the superior thoracic aperture down to the thoracic outlets. This bone is dagger shaped, is like the shape of a sword that has an handle, a blade, and also the tip. And this is the handle, which is the superior part of the sternum, the manubrum. And inferior to that, we have the blade region, which is the body of the sternum. And the more terminal end is the symphoid process, which is the tip of the sternum. And we've also said that the sternum is seen in the anterior midline region of the thoracic cage. So it also forms part of the structural component of the thoracic cage. So let's go further to say the functions of the sternum. The sternum has a protective function, so it helps to protect the thoracic organ. Remember in our previous slide, we established that the sternum forms part of the structural component of the thoracic cage. We said that it is seen in the anterior midline of the thoracic cage. And the thoracic cage, we know that it helps to protect the thoracic cavity. And within the thoracic cavity, we have thoracic organs. And these organs are housed by the thoracic cage, which the sternum also forms part of its structural component. So we can establish or state that the sternum also has a protective function. It also creates site for bone. As we go through with this lecture, we see that there are indentations that are created around the sternum, which are used to articulate with bones. It also creates attachment site for muscle. This will also be unfolded as we go further with this lecture. It enhances respiratory processes. And because the sternum also exhibits some form of movement within its structural component, it also helps to either increase or reduce the thoracic cavity. And by so doing, it also contributes to the process of respiration. So at this region of the sternum, which is the region where the manubrum connects with the body, there is a grade of movement that is seen within this region. If you look at this image down, within the manubrum and the body of the sternum, there's a grade of movement that is established. And as this movement occurs, it helps to either increase or decrease the thoracic cavity, thereby contributing to respiratory process. So now let's look at the structure of the sternum. What is the anatomy or the morphology of the sternum? The sternum is composed of three substructures or regions. We have the manubrum, which is the most superior region, and this is the manubrum. The manubrum is the handle of the sternum. Remember, we said that the sternum has a presentation of a sword. So the handle is the region where it is held, and this region is the manubrum. And distal to the manubrum region, we have the body. The body is also referred to as the blade, and this is the body of the sternum, highlighted in blue. And more inferior to this, we have the symphoid process, and this is the symphoid process, which is the most distal region of the sternum. This is also called the tip of the sternum. So you can see that the sternum itself is made up of different structural components, and this we have highlighted. So let's take each of these regions one after the other to see the specificity that they present. Going to the manubrum, which is also referred to as the handle. The manubrum is quadrilateral in shape. We say that it's the most superior region of the sternum, and it is also the thickest region. And looking at this configuration, we see that this is a four-sided presentation. The manubrum has a thick upper region of the sternum. It's made up of two surfaces. So we have the anterior surface and the posterior surface. The anterior surface is the surface that is directed towards the anterior part, while the posterior surface is the region that is directed posteriorly. Also, it is made up of four borders. We have the superior border, and this is the superior border. This is the upper border. Then we have the inferior border, which is the lower border, and we have two lateral borders that are seen by the side, and this is one lateral border and this is the second lateral border. So we have two surfaces, anterior and posterior surfaces, and we have four borders. So if you look at the inferior border of the manubrum, at this region is where it articulates with the body of the sternum, and the joint that is formed at this region is the manubrosternal joint. This joint is also referred to as the sternal angle of Lewis. And if you look at the pattern by which the manubrum connects with the body, we see that it is not along the longitudinal plane. there's a deviation around this region or an angulature that is created so that the manubrum is connected to the body of the sternum through an angle that is a bit lesser than 180 degrees. And that is why you see this curvature created. So the manubrum is not in a vertical plane with the body of the sternum, and that is why this angle is created. So the joint that is created between the manubrum and the body of the sternum is a secondary cartilaginous joint. And an example of this joint is a symphysis. We know that cartilaginous joints that are seen along the midline plane are symphysis. So a very good example of a symphysis is the manubrosternal joint that is classified under the secondary cartilaginous joint. If you want to do a functional classification of this joint, we can say it's a synarthrotic type of joint, which means that they allow for little grade of movement. So let's look at the indentations that are created around the manubrum. We've said that the manubrum is the superior region. So we have indentations that are created around it. And of course, we've established the different borders of the manubrum. So let's look at the superior border. Around the superior border, we have an indentation that's called the jugular notch. This is the jugular notch. It is an indentation that is created in the superior midline border of the manubrum, and this region arrowed yellow is a jugular notch. This jugular notch, if you try to trace it down in terms of surface marking to where we have the manubrosternal joint, it is about 5 cm in length. So this can be used to do surface marking of the manubrosternal joint. So going to the two lateral border of the manubrum, we also have indentations that are created. And the first one, the clavicular notches. The clavicular notches are 2 in number. The jugular notch is just 1, as we've established. It's just seen along the median superior border. For the clavicular notches, we have 2, one on the right and one on the left. And from the name, what this indentation receives is the sternal end of the clavicle. This is the clavicle highlighted in dotted black. And the clavicle, of course, we know extends from the back posteriorly, and it is connected anteriorly to the sternum. And the region of the sternum where it connects to is the lateral part of the manubrum of the sternum. And it is this region that we have the clavicular notch, which is the indentation that is created at the superior lateral border of the manubrum. And this is the clavicular notch. And the joints through which the sternal end of the clavicle is connected to the clavicular notch at the manubrum region is called the sternoclavicular joint. So this region is where the sternoclavicular joint is created. Also, we have the costal notches. The costal notches, from the name, we know that their indentations are created to articulate with the ribs. And of course, we know that the sternum are not directly connected to the ribs, but are connected through the costal cartilages. So we have 2 costal notches on the right, and we have another 2 on the left. But let's see the pattern by which these notches are created. For the first one, which is seen inferior to the clavicular notch, this first notch is a full notch, is a complete notch, so to say, that is created. And what it receives is the costal cartilage of the first rib. So this is the costal cartilage of the first rib, and it tends to create a complete notch that helps to receive the costal cartilage of the first rib. And we know that the costal cartilage will be connected to the first rib. So this is the first costal notch. Then we have another notch that is created inferior to this notch, which is also a costal notch. But this notch is an incomplete notch. So it's a demi-facet that is created around this region, which tends to create half of what is needed to receive the second costal cartilage. And this is created just around the manubrosternal joint. Just at the terminal end of the manubrum, we have this notch created. So this then falls into the region where we have the manubrosternal joint. But this facet is half, and that is why it's called a demi-facet. So the remaining half will be supported or contributed by the superior part of the body of the sternum. So when we get to the body of the sternum, we would see that the first notch that will be created will be a demi-facet to support this hemi-facet to now form a complete facet that is seen around the manubrosternal joint to receive the second costal cartilage. You can see how interesting this is. So we have 2 costal facets. One is a full facet and one is a demi-facet. Also to add that we have the anterior border of the first intercostal space. We have the intercostal spaces around this region between the upper and the lower costal cartilages. and the corresponding ribs. But the anterior border of the first intercostal space is what is seen at the lateral border of the manubrum. And this is the region here on the lateral border of the manubrum between the first and the second costal cartilage. So it is the anterior border that is seen around the lateral border of the manubrum, because this is the anterior border, while the posterior border will be seen at the posterior part where the ribs connect with the thoracic vertebra. This creates site for attachment of intercostal membrane and also intercostal muscle. So we see that in between these costal cartilages, we have spaces. They are not continuous. There are spaces created between them. And these spaces are called the intercostal space. And this is the first intercostal space. Going further, let's look at the body or the blade of the sternum. This is the region highlighted in blue, and this is the body or the sternum. It is the region that is located inferior to the manubrum. It is the longest thin extension that tends to join inferiorly with the symphoid process at the symphosternal joint. And this is the symphosternal joint where the body connects with the symphoid process. This joint is a primary cartilaginous joint. Also to add that the body of the sternum or the blade also has two surfaces. It has the anterior surface and also a posterior surface. The anterior surface is the surface that is directed anteriorly, while the posterior surface is behind the surface that is directed posteriorly. Also, it has four borders. It has the superior border, and this is the superior border. It is at the region of the superior border that it connects with the manubrum, and an inferior border that is seen at the inferior region where it connects with the symphoid process at the symphosternal joint. And if you look at the inferior border, you see that it tends to taper as it goes downward, and this is just to fit into the alignment of the symphoid process. It also has lateral borders, which are two, one on the right and one on the left. So it has two lateral borders, just as what is presented in the region of the manubrum. Let's look at the indentations that are created around the lateral border of the body or the blade of the sternum. This is the lateral body or the blade of the sternum that is situated or located inferior to the manubrum. And laterally, what we have are the costal notches. These are the costal notches highlighted in green, and these are indentations that are created on the lateral border of the body of the sternum. And what this receives are the costal cartilages from the second to the seventh rib. And also to establish that these costal notches also have the pattern by which they present themselves. If you look at the upper part, remember we talked about the demifacet that is created at the distal end of the manubrum. This demifacet will have to be completed by another demifacet to form a full facet, and this will be created just at the beginning of the body of the sternum, and this is the first facet that is created to give this completion. And as this completion is done, it is going to receive the second costal cartilage, and this is what is created around that region. And more inferiorly, we now have complete or full facets that are created. Also, this pattern tends to present itself around the symphoid process. There is also the formation of a demifacet that is formed at the inferior part of the body of the sternum. And this demifacet is like half, as we've said. It's going to connect with another half that will be seen at the lateral border of the symphoid process to form a complete facet, which will now connect with the seventh costal cartilage. So we have two demifacet. One is created at the upper part and one is created at the lower part of the lateral body of the sternum. Then we have complete or full facet that are created also on the lateral part, and these are seen between the third, the fourth, the fifth, and also the sixth costal notches, while the superior and the inferior costal notches are created as demifacets. So they are half. So that is the pattern by which they are presented. We have the superior demifacet, which tends to complete what is already created by the inferior part of the manubrum, just around the manubrosternal joint, to receive the second costal cartilage. And we have another one at the inferior part, which is also a demifacet that is created to receive the seventh costal cartilage. Of course, it's also a demifacet. So the remaining half will also be contributed by the demifacet that will be created on the symphoid process. So you can see how this is established. Also to add that we have the anterior border of the intercostal spaces that are seen to align at the lateral border of the body of the sternum. And this is created around this region. So the indentations that are created in the lateral border of the sternum, between those indentations, we have the alignment that forms the anterior border of the intercostal spaces. And we've said that the intercostal spaces are spaces that are created between the costal cartilages and the corresponding ribs. And of course, they extend from the anterior part down to the posterior part where the rib is connected with the thoracic vertebra. But the anterior border is seen in the alignment of the lateral border of the body of the sternum. So going to the last region of the sternum, which is also referred to as the tip, is the most inferior part of the sternum, and this is the symphoid process. This structure is small, is thin, and it is usually pointed, although it may present a quadrilateral configuration in some subjects. The symphoid process may also appear to be bifid in some cases. So you can see the number of variations that the symphoid process can present in individuals. But what is mostly seen is that it appears to be pointed. So it is a cartilaginous structure that ossifies with age. Initially, it is cartilaginous. So as growth proceeds, just around the age of 40, it becomes ossified and it will be transformed into bone. And it tends to afford attachment for the sternal body, that is infosternal joint. So it creates attachment sites for the body of the sternum and also muscles and ligaments. So let's look at the indentation on the symphoid process. Remember, we talked about the demifacets that are created at the superior part of the body of the sternum and the inferior part of the body of the sternum. At the superior part, the remaining half will be contributed by the manubrum. So the remaining half at the lower part will also be contributed by the symphoid process. At the upper lateral part of the symphoid process, we also have the creation of a demifacet. This demifacet will unite with the demifacet that is created at the lower part of the body or the blade of the sternum to form a complete facet. And this facet will receive the 7th costal cartilage. So this is the indentation that is created around this region. Let's look at the joint of the sternum. The joint of the sternum, will classify it into two: the joints that are created within the structural component of the sternum, and also the joints that are created between the sternum and also the surrounding structure. For within the sternum, we have two. We have the manubrosternal joint. This is the manubrosternal joint that is created between the manubrum region and also the body of the sternum. Then we have the symphosternal joint. This is the symphosternal joint more inferiorly that is created between the body and also the symphoid process of the sternum. You can see that within the sternum we have joints because they are made up of bones that are joined together. Then going outside the sternum, where the sternum tends to connect with structures that are seen around it, we have the sternoclavicular joint. This is the sternoclavicular joint. And this joint is created around the manubrum region of the sternum where it connects with the clavicle. Then we have the costosternal joints, which are joints that are created between the costal cartilages and the sternum. So these are the costal cartilages that are highlighted in red, and you can see that they are connected to the manubrum region. They are also connected to the body of the sternum and also the symphoid process. And these costosternal joints can also be referred to as the stenochondral joints, the chondrosternal joint, and also the sternocostal joint. So it depends. If you still break the name down, it will still mean the joint that is created between the sternum and also the costal cartilages. So let's look at the muscular impressions that are created around the sternum. This will be good for students that are taking steeplechase exam, where different regions of the sternum will be marked and they will be asked to state the muscles that are related to this region. We have an impression created around where the clavicle connects with the manubrum region of the sternum, and this region is highlighted in red. This impression is created for the attachment of the sternoclavicular ligament, which is the ligament that connects the clavicle to the sternum. So there is a ligament that helps to reinforce this joint around this region, and this impression, of course, will be close to it. So if this region is marked, we should know that is an impression for the sternoclavicular ligament. Around the anterior surface of the manubrum, you have the impression that is created for the sternocleidomastoid muscle, and this is highlighted in green. You know that the sternocleidomastoid muscle has 3 insertion points. It has on the sternum, it has on the clavicle, which is the cleido, and it has on the mastoid process of the temporal bone. So it has like 3 insertion points, and one of the insertion points is the sternum, and the region of the sternum where it is inserted on is the manubrum, and this is the region. So if this region is marked and you are asked to state the name of the muscle that is related to this region, it is the sternocleidomastoid muscle that is related to this region. So if you go more inferior to the impression that is created for the sternocleidomastoid muscle, still around the region of the manubrum, there is an impression that tends to extend downwards to the lateral part of the body of the sternum, and this is highlighted in blue, and this is for the pectoralis major muscle. So you see it extending from the manubrum, crossing this manubrosternal joint downwards, just around the lateral border of the body of the sternum. You see the impression created for this muscle, and you also see it on the other side. So if this region is marked, we should know that it's for the insertion of the pectoralis major muscle. So going more inferior, around the anterior surface of the symphoid process, this is the symphoid process around the inferior parts. In the anterior lateral region, you have a region that is highlighted in light blue, and this region is related to the rectus abdominis muscle. So this region, if marked, is the rectus abdominis muscle that will be related to this region. Then if you go more anterior, around the tip of the symphoid process, you have a region that is highlighted in red, and this region is related to the linea alba. The linea alba is a fibrous sheet that tends to extend downwards along the anterior part of the abdominal cavity. Different regions, of course, may be marked, and you'll be asked to state the muscle that are related to them. So this can give us an overview of what that is. So we can check our understanding of this lecture through the following question. And the first one is to describe the structural feature of the manubrum. This we have adequately explained in this lecture. The second question is what and where are the clavicular notches created? So this is like a 2-in-1 question. What are the clavicular notches and where are these notches created? Then the third question is to highlight the joint of the sternum. We've also stated that the joint of the sternum can either be within the structural component of the sternum or with the surrounding structure. So thanks for watching. Let's meet again in our next class.